So if you have problems carrying bags like this, like purses over the shoulder, or book bags like this over on your back, because it brings on some neck pain, triggers headaches, triggers migraine attacks. I'll show you a progression I'm doing right now with a client of mine. And this client is having a lot of problems with carrying her purse, can't carry her diaper bag, the book bag, and we live in a very walkable city, so this is a very big problem for her. So this is kind of the progression that I'm going through with her to get her to be able to tolerate carrying bags while out and about through the day and not triggering that muscle tension, and it goes into a headache. So this is what that kind of looks like. While the bag, it could be the exact purse they're going to be using or the book bag, but this is something they can do at home. This is why virtual therapy is great for this. Right? Bag here. I'm going to grab a couple weights. This is 2.5 pound cuff weights. I'm going to put them right in the bag. There. I'm going to put on my shoulder, and I'm just going to do one-sided shrugs, right? And from here, depending on where their tolerance is, I might start with 5 to 10 repetitions from 1 to 2 sets. And from there, then we progress up maybe to 10 to 15 reps of 2, 3, or 4 sets. When that starts getting tolerable, they're not reporting symptoms or very minimal symptoms and soreness afterwards, we go and increase the weight. So I'll take these out. Now I'm going to put in 5, 10, and 15 pounds, right? We can do this with the book bag too, but I'm just going to show you with the purse. Here, goes on the shoulder. Again, unilateral shrugs. And this is from a high surface, right, on this table, so I don't have to lift the bag as high. But then when this gets easier, I'm going to drop the weight a little bit, and we're going to start acting like they're really walking with it up and to my shoulder, right? Or if we're going to do the same side, move up and to the shoulder, and then do a couple shrugs, and then down and up, and a couple shrugs, getting them used to moving this bag the way they're actually going to use it in real life in the city, okay? Then from there, I'm going to put in a lot of weight, more than what they're going to typically have in this bag, because I want to build up their resilience, because we're only going to be together maybe for a half hour, an hour session. So they have to really build up their functional strength, so we're going to have to push the volume. But then the next progression is then walking with that bag. So I'll really load it up, make it nice and heavy, have them put it on the side that's most triggering for them, and I will literally have them walk back and forth across either their house, this clinic, in the hallway, and then I might add in a progression of some head turns, add in some vestibular stimulation. What does that do to the muscles of the neck when they're trying to stabilize the head? That is how I would progress somebody if they're really having issues with carrying bags and it's triggering a lot of headaches. So try that at home, or reach out to me if you have questions about how to make this work for you.